GE. It is suitable for general family viewing.
All right, welcome back again. It's another Thursday. My name is Dr. Chepsi. I'm your host, and this is Body Garage, the art of well-being. Now, today we are going to talk about eye and eye health, and approximately about 7 million Kenyans have a certain type or a certain condition of an eye that involves the eye. And so that's what we're going to talk about today, and we have Dr. Lily today here. Karibu sana.
Thank you. Thank you so much for having me in your program.
Karibu.
Yeah, it's a pleasure to always speak about eyes.
Yes.
Yeah.
It seems you're so passionate about the human eye.
Yes, that's what I do for a living.
Yes.
And and everything I do is connected with the eye. So that's where my passion lies.
Yes.
Yes.
Well, just to start us off, I mean, what made you to be so much interested with the human eye? Because, I mean, if somebody is told that they are people specialized with a very small part of the human body, just to say, somebody might really be surprised.
So my journey with eyes starts where I used to be a medical officer and a medical intern. That was at the Coast Provincial General Hospital. So during internship, as you know, we get to rotate through obstetrics, gynecology, pediatrics, surgery, and medicine. So when I became a medical officer, I decided let me do a rotation through what we used to call the special subjects, you know, ophthalmology, ENT. So just to get a feel so that by the time I'm specializing, I have a feel of all the areas I could rotate in and make an informed decision. So when I was working there, at least I had a good mentor. And the moment I rotated through ophthalmology, I think it was just set. I knew, maybe the way my brain thinks, I'm a bit structured in the way I think. And I found the eye interesting. You know, many of the things you actually see, there's not so much theory like maybe say in medicine. It's what you see. And I found that there was a good mix with, so in ophthalmology, we treat with medicine. We also do surgical procedures, a lot of surgery, because, you know, everyone has two eyes.
Yes.
And then there's research involved, a lot of eye research involved, public health. So it's, you know, it's a good mix, it's a good pot, you can find everything there. And right now, even my profession reflects that. As we were discussing just before we started the show, an ophthalmologist, glaucoma specialist. I'm also a physician-trained research scientist. I teach, which you'll find also in ophthalmology. And I teach, do clinical work, and I do research. So all that you find in the eye, and also a lot of public health, related issues. So I found that, at least in ophthalmology, I was able to, from the things I learned in undergraduate, I was able to merge them properly in ophthalmology. Things were more or less structured. I can be able to see things. There are many things you can do something about. And quite honestly, it's an underserved area. Yeah, you're right. Actually, about an eighth of people, about a seventh of our population do have eye conditions. Yeah, and that's in the world. Yeah, we have a population of almost 8 billion.
Yeah. And
we have almost 1 billion with some eye condition or another.
Yes.
And we have very few ophthalmologists. We're barely getting above 100. So it's quite an underserved area. And yeah, so I felt the need to actually make an impact. Through what, and from there, I don't think I moved. I didn't even rotate in ENT. I just found, I started with ophthalmology, so that's where I got stuck. Yeah.
All right. Now, later on, we will mention where maybe somebody is watching you, where they can find you. But we'll talk about that as we close. All right. But now let's talk about this interesting structure in the human body, the eye. Like in simple terms that the people can understand, what makes up the human eye?
So back to basics, I think many of us have been through the basic school, nursery school, and I think there is where we're taught about the senses. And one of the senses is actually sight, what we see. Most of us have been able to perceive, to have that sense of sight. Yeah? And that's something we are very grateful for, to have the sense of sight, most people. And, that means there are some people actually who don't have the sense of sight, to be able to see things. And we do have two eyes. Interesting. Two eyes that we're able to perceive the sense of sight. And so the eye, and that's what you see people with when you first meet them. You look into their eyes, you note, and in fact, when you don't see someone with eyes, it strikes you. When you look at someone's face, the first thing you'll see probably is their eyes. And so we have two. Luckily, at least we have a spare one in case of anything, but most of our eyes will be working, both of them. And I have a model with me. So we have what we see. You know, when you look at someone, there's the front part you'll see. So there's a clear glass structure, which is what we call the cornea. And you may think your eyes are brown, but actually there's a glass right in front. And what gives the eyes color, and now you'll notice when you look at people of different races, is that the color is given by what we call the iris. The structure is what called the iris is what gives the eye color, but just in front of it is the clear glass structure, which is called the cornea, and is very important for vision. Then right in the middle of the color, the place that gives the eye color is what we call the pupil. And that's where light passes through. So it comes through the glass structure. It passes through, there's a chamber here. If I remove this, there's a chamber. It's called the anterior chamber. And then the colored part of the eye. And then here there's
it's like a hole.
It's a hole, an aperture that allows light to pass through. And that's what we call the pupil. And then right behind the pupil is another very important structure, which is called the lens. And this allows and this focuses light on the back now of the eye. We don't usually see this part of the eye, but the eye is actually an eyeball. It is an eyeball, as you can see. And this is when it's sectioned in half. And what it does, it has fluid right over here also.
The whole...
Yes, the entire eye actually has fluid, and this is what we call the vitreous, and it gives the eye some shape. It's like a ball, you know, there you have a soccer ball and it's turgid, it has some shape. So the lens actually focuses light on this other very important structure. It's a sensory structure, and this is what we call the retina.
The ones that's lining the ball.
This structure that lines the ball has what we call photoreceptors. Once the light comes in, it is received and then it's changed into chemical energy, and this is what is transmitted. Now, the retina has some certain cells within it that form fibers. They are called ganglion cells. They form fibers, and they all come together. This important area here, which you call the nerve of the eye, the optic nerve. And there's a saying, actually, if you think the eye sees with the brain, the eye sees with the eye, it actually sees with the brain. So this is what transmits impulses to the eye, to the brain, to the brain. So we actually see with our brain. It's fantastic. You have this eye over here, and it has fibers that are connected all the way to the brain. So the brain is very important in vision. And many times you'll see if there's a problem with the brain, then we will not be able to see. There's a certain area in the brain that is mapped for seeing. So that is the eye in a nutshell.
Wow. I trust the viewers have learned some anatomy to say. Now, in Kenya, to be specifically, you mentioned that there are some what you call priority eye diseases.
So Kenya has a government, and within the government we have the Ministry of Health. And in the Ministry of Health, we actually do have an office for ophthalmic services. And we align our goals with also the world goals. We actually have a forum. The WHO has priority eye diseases, and which happen to be the same of what we need to work on in our country. So there are certain diseases that are important, and they are important causes of blindness and visual impairment. In our population. These are the diseases we've seen. If we did something about it, then we reduce the impact of poor eye health in the country significantly. So you go for the top, so that once you work on the top, you're able to And most of these diseases are reversible.
Yeah.
They cause what we call visual impairment and blindness, but most of them can be reversed. That's the beauty. We can actually do something about it.
Yeah.
And people don't have to be, what we say, needlessly blind. So top on the list is actually cataracts. Yeah, and many people suffer from cataracts worldwide. Yeah, we're trying as much as possible. Even in the hospital, we actually work a lot. It's one of the main procedures we do. Yeah, and we've seen that, and most of the time the outcome for cataract surgery is good. And people reverse. We actually, imagine people reverse.
So somebody was blind and then they are able to see again.
In fact, for those of you who read the Bible, I always say Jesus was an ophthalmologist. He actually, he healed, I think there's a story there where he healed someone and they were not seeing and they saw. So, and it is that dramatic. They come to the hospital not seeing and the next day you're able to see. Once once the cataract is removed. So that is one priority eye disease. Another priority eye disease we have is something we call refractive error. I can see you're wearing glasses. Very main cause of, it's actually higher than cataracts. So it is a very important cause of visual impairment and even blindness, and especially in the young group. And right now there's an epidemic worldwide. Because of a lot of near activities, reading, working on gadgets. And you'll notice, even in our country, the studies show that particularly in the urban areas, we do have a lot of refractive error, and especially what we call myopia. So that's the pandemic that's going on right now. It's called the myopic epidemic. So, and many of the times the studies, with the ones we've done here, we've noticed people with refractive error, the people with far-sighted are mostly found in the rural. Most people in the city have short-sightedness, and they're even more. So this is an important cause of blindness, and actually you just need spectacles to correct it. So it is very amenable to treatment, just glasses. Some people may need contact lenses out of choice, or that is the best way to correct them. We also do refractive surgery for people who are using glasses if they would like to drop their glasses, although that fits a certain criteria in which people we have to check if you meet criteria to be able to drop your glasses or not. So those are the main ways we deal with refractive error. Then this trachoma. Trachoma used to be a main problem in terms of blindness, but there have been many activities in the country, especially applying what we call the SAFE strategy, where we encourage environmental cleanliness, because this was a disease found mainly in the people who are nomads. People would have cattle around them. They don't have access to clean pastoralist community. They don't have access to clean running water. So this has been a main problem for them. So just giving them basic things like washing their faces, especially for children, mothers, those are the ones who get affected with trachoma, and giving them antibiotics and doing surgery for patients who have what we call trichiasis, the rubbing of this clear glass in the eye, and that can cause blindness. So surgery is done for that. That's what the SAFE strategy is in a nutshell. That administration of antibiotics to populations usually is done about once a year, and that has greatly improved this trachoma. The incidence has gone down remarkably. We're even seeing less than half the cases. That is back in 2018. So there's a current study going on right now, so we will know the results, where we are with trachoma nowadays.
After the result, the study is concluded.
After the study is
concluded. I think we are going to take a break, and we will pick right where you have left, so stay tuned. All right, welcome back. You are watching Body Garage, the Art of Wellbeing. I'm your host, Dr. Chepsy, and we are talking about eye health, And right now we continue the conversation on priority eye diseases. You had mentioned about trachoma and processes so far, and there seems to be victory, right? Yes. So now you mentioned also about pediatric eye diseases, something like that.
Yeah, actually pediatric eye diseases are also a priority, you know, because even though they may be a bit fewer compared to adult diseases, but if you're going to speak in terms of economics in our society, children actually have so many more years of life to give. So if a child is blind, then you have to count all the years they'll remain blind and not contribute economically. Plus, they will be draining the economy economically because you actually have to, spend money to be able to take care of blind people. But I'm not saying there's anything wrong with that, but where we can do something about it, in terms, actually pediatric diseases, those are, I think I'll put high on the priority list because they have all these person time years. I think you learned about that in public health. So anything pediatric is very important. You save a child's life, you give our country another citizen to serve as maybe, now the life expectancy is around 65 years. So they'll be able to serve for all those years, build the economy. So for the pediatric eye, priority eye diseases, top on the list are refractive errors, we had mentioned them. Then there's also cataract, pediatric cataracts, and these are urgent. We don't keep kids with cataracts. As soon as, and these are some of the things we check when we go to the clinic, when babies are taken to the clinic, and it's usually up to 5 years. And even if you look at the book for immunization for mothers, there are some things the health worker usually looks for. And even you as a parent, you can read, and even there are photos to show what we are looking for. So any white reflex is usually a priority. So cataracts, those are operated on immediately because children can learn to forget how to see. They're so plastic in the way they operate, you have to actually operate them as a priority. Another thing is glaucoma, childhood glaucoma. That also is surgically treated to reduce pressure in the eye, to avoid optic nerve damage. The interesting thing with children, when the pressure is high in the eye, even the eye grows. So they have what we call ophthalmos, they have big eyes. So we have to prevent that, because it's not good for them when it's growing at that rate. And also to prevent nerve damage. You know, the nerve we had talked about, that we can't reverse if it's spoiled. Another thing which is now going, good news, thanks to a robust immunization system we have, is vitamin A deficiency. Once a very important cause of blindness, but you realize our schedule is very precise. Starting from 6 months, we give children vitamin A, a boost. Even the lactating mothers who are breastfeeding are given vitamin A in the clinic. So that has really come down. Emerging, which might come, it's not there, but I see it with preterm babies a lot, because we are now having an increased life expectancy of preterm babies. Maybe something we call retinopathy of prematurity. That's a discussion for another day, but may actually start becoming an important cause of blindness in children. So those are the main, I could say the main important childhood causes of blindness. And strabismus. Strabismus may not cause blindness, but if an eye is always deviated in a certain direction, the child may forget to see in that eye. So it needs to be corrected, and that also is available in the manual, the child handbook. It's actually a very informative one, so you're able to see what is important, and all these things are highlighted. One other thing. There's a childhood cancer, the most common intraocular tumor, and it's called retinoblastoma. May not be we still, at least in our country, we still mention it. And that also is available in our guidelines, any cause of white reflexes in the eye. So if people...
It's obvious thing that a parent, for example, can pick.
Actually, if you have a child, even in the neighborhood, and you notice, especially during dusk when the pupil is a bit bigger, and you notice something is white in the eye,
where it's supposed to be black.
Where it's supposed to be black. Then that is a child who needs to be taken to the hospital. And even if you're sent away, please go to the next hospital. Someone somewhere will hear you. Because that is how all these diseases start. Something was white in the eye. And I've seen most of the people pick it up early. So when you see something white in the eye, the child has to be taken to hospital. Yes.
All right. Now, before we move on from that, I think there is usually this thing among pupils, students, and many times they are mistaken for being like they're acting out. So let's say a girl in Form 2 says, I'm not able to see well. And the parents are like, no, you are just pretending, you don't want to go to school. So it's not that they're pretending, it is true, it's an emerging thing.
So I would always say, at least being a physician and a doctor,
Yes.
I have to rule out every other cause of not seeing before I say they don't see.
Yes.
Yeah. And actually, sometimes maybe they could be other. Remember, we did this in psychiatry, hypochondriasis. But for me, that is the last diagnosis on my list. I first have to work with the patient right in front of me. And many times, I think, at least from my experience, many times they do actually have problems. And even some of them, I did some research amongst high school students in terms of refractive error. Actually, many don't even know they have a problem. They think there's so much going on in the body, so much growing up going on. They think this is how I'm meant to be seeing. So many of them don't even know that they're having issues. Another thing I've seen, especially amongst that age group, and I don't think you should ever say they're pretending, is when they get it's a rare condition, but it can happen. When you have an inflammation of the optic nerve, something we call optic neuritis, and I've seen it. So there, I don't say that someone is pretending. Let me first rule out, and there are objective ways we can do that. So first take your child to the physician before you make that decision. Take the child to the physician, then once the physician can't find anything, we may say something else is going on, but many times we find there's a problem.
Sure.
Yeah.
All right, now let's talk about the other age group, now the elderly, the senior citizens now. They face quite some kind of unique eye challenges to them. What will those ones be?
So actually those are majority of our patients. Yeah, as we undergo aging, the eye also undergoes certain changes. Yeah, and there could be other surface conditions. Yeah, could probably dry eyes. Yeah, because the glands that produce tears at basal level are not able to produce them as well as they used to. So that is one very common condition, or maybe due to infection of the glands, they could get dry eyes. Now, the most common are these priority diseases we're talking about, featuring cataract. And there are also emerging conditions that are coming up. You see, with the life expectancy going up, I think when I started medical school, it used to be down at 45. By the time I was finishing, it was at 55. Right now, we are at 65. So we're doing really well to keep people alive longer. So we'll see, and we're already seeing it, that a lot of eye conditions are emerging. And many of them have to do with age-related, this structure called the lens. Remember we talked about behind the iris, we have the lens. So when we have, this is supposed to be clear. So when we have it clouding, that's what we refer to as cataract. And that is one of the commonest causes, actually is the commonest cause of visual impairment and blindness in the older age group. So that is very important.
When the lens is not able to do its work properly.
And they even start saying they're feeling like there's a cloud in their vision. And then now there's a lot of lifestyle and also just other conditions that come with probably age as a risk factor. We have, and now these are the emerging causes of blindness now. We have diabetic retinopathy and glaucoma. Sometimes diabetes is associated with a higher rate of glaucoma, but that doesn't mean to say they have to be interrelated. Some people get glaucoma, they have very good lifestyles, but they're just genetically prone to getting this disease called glaucoma. So what is glaucoma? We've talked of all these structures, and then there's one called the optic nerve. So when we start getting cells in the nerve dying, it starts causing restriction of our field, how far around we can see. Around. That's how it starts.
So you can't see the far corner.
People say they have problems crossing roads or things like that. And many times it is associated with pressure increase in the eye. So, but glaucoma is very difficult to detect just by science, because many times even people may have advanced disease, but they still have pretty good central vision. Yeah? They are very good. Eh? So this is one condition, and that's now where I start recommending early checkups. Yeah, and I think our country guidelines are as early as 35. Some of the other countries are around 40 years, and I usually say around 40th birthday, you ought to give yourself an eye checkup as a birthday present, because that's the only way we can catch glaucoma early. Glaucoma is all about catching it early before it damages the nerve in the eye. And when the nerve in the eye is damaged, we can't do anything about it to return it. We only try to conserve what is left.
All right.
Yeah, so these are main. Now about diabetes. Diabetes causes another problem with this structure at the back of the eye, the retina. Yeah, when the sugar is high in the body, and many times diabetes causes problems with blood vessels. And if you look at my model, you notice there are blood vessels.
Yeah,
I know there's
inside.
blue and red, but there are blood vessels at the back of the eye. So diabetes affects these vessels and also affects how the sensory structure we call the retina works.
Yes.
Yeah, so it's actually becoming a very big cause of blindness, and also hypertension. Yeah, many people in our population above 50, almost half, actually have hypertension. Yeah, so it is a
Half of the people.
almost.
The people that you see.
Above 50. No, I'm not talking about the people that I see. This is a study that was done by an ophthalmologist. She was looking for eye diseases in the old population. Older meaning people above 50.
Yes.
And one of the things, even here, yeah, maybe I'll walk you through what we do in an eye check here. One of the things we do is look for hypertension and diabetes, because many times the eye in itself doesn't usually have issues. The diseases that are occurring elsewhere in the body sometimes manifest themselves in the eye. So we are doctors before we are ophthalmologists. We have to make sure that the commonest things, which is hypertension and diabetes, are dealt with first, because those have issues, bring many issues with the eye. Yeah, so you get hypertensive retinopathy is one of them. And that ophthalmologist did that study and found up to 50%, just above 50 of people above 50 have hypertension in our population. Yeah, so it's actually a very serious condition, hypertension. Most of it is controlled, but when you come for the eye checkup is when sometimes we actually pick it.
Yeah. All right. Thank you so much. I think we are going to take a break now, and when we're back, we'll talk about emerging eye problems in the digital age. Stay tuned. All right, welcome back. You are watching Body Garage, the art of well-being. My name is Dr. Chepsi. I'm your host. We are talking about eye health. Now, right now, Dr. Lily is going to discuss with us about how the phones, the computers, and anything that is a screen and emits light is affecting our eyesight. Yes.
So you're actually right, yeah? It's something that is with us. I can see you have one. It's part of what's emerging, yeah, and it is a diagnosis, yeah, and people, these are gadgets we have with us, but we can't get rid of them. I mean, they're important in our work. Many times we have to work with them. So maybe instead of getting rid of them, just to know a few pointers of what to look out for in terms of digital devices when we are working. And a lot of times, you know, they cause us to stare. Yeah, if you notice, you forget to blink when you're on your iPad. Yeah? So maybe to keep a reminder, a mental note to remember to actually blink, because your eye is moist. And it needs to stay moist for a reason, to work properly. Because just in front of this cornea, we have what we call the tear film, a precorneal tear film, which is also important for sight. And we need to keep this organ called the cornea moist so that it can function properly. So it's important to put a mental reminder to blink. Because many times people will come with dry eyes, and you ask them, what do you do? Many of them are on screens. So some people do forget to blink. So what I may recommend is sometimes we can substitute that tear film and give you drops which you can use, and they sort of hang on there a bit longer. So you can use lubricants, what you call ocular lubricants, to keep your eyes moist. And some people, it's just not, they remember to blink, but they can't keep up with that visual demand. So we still may prescribe some ocular lubricants. Having mentioned that about screens, the people I think may do a little less with screens are young people, babies, children. Yeah, even babies, I see them with phones.
Cocomelon.
Yeah, it's okay. I find it a bit disturbing. Yeah, and yeah, maybe also the social amenities around us are not helping either. Yeah, because you find all these apartment blocks coming up. So kids, maybe when I grew up, probably there was a lot of field and land
Playing
to play
around,
with.
yes.
It's very important.
Yeah.
It's actually very important because this, as I had spoken earlier about this myopic epidemic, it's real and it's with us. Yeah, and it's because many children are just either on screens or they're on their books. Children actually have to get time to kick a ball, chase things that are far, you know, adapt. Because I told you they are very plastic. The moment they can easily get used to just working here, and their eye actually starts accommodating in a way that it's just used to working here. They are very plastic. So we actually have to get our kids outdoors, get our children outdoors. Right now, Africa has the least amount of refractive error, but we are catching up with people. Yeah, Asia has a lot of refractive error, almost up to 70% in some populations have myopia. That's crazy. So us, at least we are somewhere, but we are going to catch up.
Catching up.
The last study I did among high school students, I found about 1 in 10, about 16%, almost 2 in 10, yeah, have refractive error. And this is who have visual impairment because of refractive error. And most of them, 10% of them were actually myopic. So we are dealing with, and even recently, as I told you, I teach, one of the last topics we're teaching about was refractive error.
Yes.
And I did a sort of a poll in my class. My class, half of them have refractive error, and almost all of them had myopia. You know, the medics who like reading all the time. So it's actually a problem. You need to get out, play, get less time, count how much time your kids are. And nowadays there are these apps that sort of tell you how long you've been on screen time. I think with children, if as much as possible, get them outside, get them less on screen time and near work. Yeah, that's what I'd say with the digital era, especially for children. It can actually help them get off glasses.
What will you comment about the use of what is called, is it photochromatic lenses? These ones, the blue light blockers.
So I think I have no issues with those. Those help. Yeah, these are different screens depending on your demand. So when you're getting your glasses, you can always say, okay, I'm working on a computer. If you can give me a filter for that, I'm going outside in the sun. You can give me a filter for that. And I actually highly recommend, if you can, to have your sunglasses when you're driving that are polarized, that can be able to block certain lights, certain UV rays. So that I have no issue with. I think they are helpful. Maybe the studies are not very robust to give us, but I see some of the studies show they may be helpful.
Okay.
Yeah.
All right. What will be the difference between now reading on a paper book and reading on a computer? Is it different? If I read a paper book for 7 hours and I read on a computer 7 hours, is it different?
I think there are no studies towards that, but the concept is how near things are.
Okay.
I don't think, you see, digital things tend to be more attractive. Have you noticed you'll stay longer on a digital device than a paper book? That's usually the problem. It's very hard to see. Okay, they're there. There are people, you'll see them on paper books for very long, but I've found digital screens tend to be more enticing. So you'll tend to spend longer near work hours on them. That's why I'm really recommending to be off them. Because you'll notice with the paper things, you'll tend to spend the right amount of time that you're meant to be there. Yeah, so the concept is not even, it's how near you're working.
All right.
Yes.
Okay. Thank you so much. Now, as we come to the close of the discussion part, what are some of the daily practices that we can employ daily to help us improve our eye health?
So apart from daily, let me skip the gun, but one thing I'd really recommend is an eye checkup. Yeah.
How frequently?
Usually for kids, we'll screen them, as I had mentioned, in the clinics that they come to. So those clinics are very important, the ones that are the postnatal clinics that we take our children to. So that's important, and we screen for some of these things. And then also in some places, if you have access, and many places, many eye hospitals will not reject you, or hospitals, at least just to check a visual acuity, how far you can read. So usually we recommend for children, once they're able to sort of detect pictures or things like that, every 2 years, until they're about 20 years of age. 2024, that's when at least full development in most people has happened. So about 2 yearly, and you'll be able to pick many things. And then we get into our golden ages where things are usually okay until we turn about 40. Then from there, at 40, you should get your your 2 yearly checkup, depending. If you have another comorbidity, in terms like hypertension, diabetes, those you have to go every year. Arthritis, those you have to go every year. But if you're generally in good health, keep your 2 yearly checkups until the day you're not here with us anymore. So that would be my recommendation.
So the first thing is eye checkups.
Eye check, because many diseases you don't know they're happening. So first of all, eye check. And many childhood, you see now we cover childhood blindness and causes of blindness in adults. You see with the screening, that is detected early, and something can be done about it. Remember, children have a whole life. So we want to catch them early. Now, on to the daily practices. So, for one thing, and with the eye, remember I said many things that are occurring in the eye may be occurring elsewhere in the body. So the health practices elsewhere in the body sort of automatically replicate to the eye. So a good diet, especially diet that has orange vegetables, green leafy vegetables, diet rich in vitamin A. Because we realize a lot of vitamin A is required for proper functioning of the cells in the eye that actually keep it moist. And then also the retina, to function correctly. And even prevent some of the age-related diseases that may come about, like AMD, age-related macular degeneration. Some of the treatments will contain micronutrients. So look at your plate. When you're serving yourself, you have to have a good diet. Remember, half of your plate has to have vegetables and fruits. The other tiny quarter, maybe some starch and some protein.
So 50% vegetables.
Have vegetables. You'll cover most of the micronutrients. Fruits and vegetables have to be half of your diet. Of course, drinking water and staying hydrated, especially that will help with dry eyes, because the eye is a mucous membrane, that will help with that. Using sunglasses and these blocks for your spectacles, the different filters, that will help also. And exercise. Exercise helps with many things, even in the eye. Exercise will help. And restricting your time on digital devices, as much as possible. Getting enough sleep. That will also be, that's important for improving eye health. And for kids, outdoor activities. Having that time to go outside and play. And even adults, I think adults should have some time where they go play. You do some sports, or if you want, run somewhere, or go to a gymnasium, if that helps. So that's what I would put in a nutshell.
All right. Thank you so much. We've come to the end of our discussion. The next part, Dr. Lily is going to demonstrate to us on a patient, with the consent, of course, on how routinely you will assess a patient, right? Yes. But before we break, do you mind sharing where somebody can find you and maybe they may need an eye checkup?
So you may find me, I dual, as I told you, I teach. So I teach at the Kenyatta University. I'm in private practice. I work in the Lion Sight First Eye Hospital as a glaucoma specialist and an ophthalmologist, and also in private practice. So you can always get me anywhere. Plus, so my details should be on the website if you're looking for an ophthalmologist. Or just call the hospital. The hospital should be able to get you an appointment if you'd like to be seen.
And social media.
Yes, and social media may be a bit quick there, but we have a very good social media in this hospital.
Yes. All right.
Yes.
Thank you so much. Thank you for staying around. Let's go on and watch a bit of practical stuff here. Thank you so much.
Hello, Nancy. How are you?
I'm fine, thank you.
And it's good to see you.
I'm back.
Yeah, I can see. I'm happy to see you come for your annual checkup, right?
Yes. Unfortunately, I think my eyes have been deteriorating because I've not been able to be seeing very, very well.
Yeah, I just saw your visual acuity test and I've noticed that you're not seeing with your current prescription properly. But as usual, we'll do the eye check first.
Okay.
Yeah. For the viewers, this is a slit lamp. Yeah, it's able to sort of slit the eye to a slit, and you see the way we are demonstrated in our model eye. I'm able to see from the front to the back of the eye, and I start in that order. So Nancy will be having you today for our viewers to be able to demonstrate how an eye check is done. And as usual, I'll require you to have your chin here. Do you have any other issues you'd like to let me know about apart from your glasses? Anything else bothering you?
Not really.
Okay. So I'd like you to place your chin right on the chin rest over here and make sure your head comes all the way to the strap over here. Okay. And now I'll adjust your head to just fit in and I'll be able to view with the beam. Make sure your head is all the way to the front. Good. So I'll give you a target. Yeah, I need you to look straight ahead. Yeah. And please look at my right earring. I usually wear the earrings for this purpose. And I can see your cornea looks okay. Okay, and just keep looking straight ahead on the earring. The lens is clear. Vitreous, as I said, is clear. Your optic nerve looks healthy. That's the right side. And remember, you have two eyes, so we'll take a look at both. So now focus on my left earring. Okay, everything is clear. Cornea is okay. Lens is clear. Anterior chamber is good. Vitreous is clear. Your anterior chamber looks good. Now look down. You need to also see your eyelid and the glands that produce tears. We are done. I noticed a bit of inflammation on the lid margin. You're sure you don't feel achy eyes or tiredness at some point? You can rest back.
At times when I wear contacts, I feel it. I think from this side, I'm not sure.
One of the eyes.
Yeah.
Yeah, so maybe just a warm compress would help the glands open up, and then will help the tear production. And whenever you put on your contact lenses, it would be good to also have a lubricant just to top up. So after this, at least your eye check, the usual eye check is good. So I'll recommend that we have an optometrist. So they'll see you, retake your visual acuity, check your old prescription, and then measure you again and see if you need a new fitting. Then you come back and see me.
Okay.
Is that okay?
All right. Thank you.
All right.
Welcome.
Great.